Hey folks, this is Jeff. I wanted to do a quick video, but first, before I start the video, I would like to say and give a disclaimer today. We're not a doctor, not a professional by any means. Any advice that I give you on the subject today is my personal opinion and experiences in my life. So this disclaimer is to show that I'm just giving some advice out of the kindness of my heart, and because we love people, and maybe any information that we can share with you would be of benefit to you. If nothing else, it would be an encouragement to know that you're not the only one out there that has these problems and that you deal with on a daily basis. But anyway, we get that disclaimer out of the way. And what I want to talk about today is severe back pain, spinal stenosis, degenerative disc disease, bone spurs. There's just a multitude, bulging discs, ruptured discs, nerve damage, muscle pain. I've dealt with back trouble for many, many years, and at some points in my life it's so severe and discouraging that you just want to throw your hands up and give up. You think you're never going to be able to get any better or improve, but there's light at the end of the tunnel. No, you may not end up getting rid of your problem totally, but management of it is a key to having a decent life anyway. You know, everybody wants to run out and have surgeries when they get in that severe pain, but sometimes surgery works and sometimes it don't. A lot of people want to run out, and I'm not judging anyone, because I've experienced some pain that you just want to pull your hair out, and you'll do just about anything to get out of that pain. If it gets severe enough, you'll take the medication, you'll have the surgery. You know, if you can't get any relief at all, you will do just about anything to get out of the pain. But fortunately, I've been able to deal with mine in a different way. Does it go away? No, it's always there. It can be worse. We can aggravate it, or we can improve it. But one thing about having back problems and disc problems and spinal diseases, bone spurs, I mean, there's a multitude of things that can be going wrong. But when you have several, you know, 2 or 3, 4 of those individual problems wrapped up into one, it's almost more than you can bear. And you'll get down weeks at a time where you can't do anything, can't function. And what I wanted to say is I went to a doctor one time in particular, and he talked to me, gave me a heart-to-heart talk about my situation and my problems and my back disease. And spinal stenosis is no laughing matter. You could have that in 1 or 2 discs, or you can have it all throughout your spine, from your cervical spine all the way down to your tailbone. It's a disease, and it's a disabling disease, and there's a lot of things that you can do to help it. But one reason I wanted to make this video is the doctor, he was real blunt with me. He said, yeah, you have these problems in your back, and he gave me some suggestions of what I can do. One thing, for instance, was my lower back was really in a bad shape. I'd fractured my T12, and it had healed up, and then I refractured, injured it again, and I was having a lot of low back pain. Walking on concrete, lifting heavy things, bending over, you know, just the normal things that you would do throughout your day become unbearable for me, and put me into bed. And I wanted to find some relief somehow, and through medication or anything that they could have done for me. and his advice was to walk. And I thought, walk? I mean, I can't hardly stand here. You know, walking's not going to help this, but it actually did help my low back. I began to walk real slowly and gingerly, not big, you know, long walks through the country, just 25, 30 yards at a time, you know, each day getting better and better, and I started seeing some relief in my back. And then another thing that he suggested to me was a great health benefit was when you're dealing with a severe health problem issue, and especially pain related, it produces anxiety, your blood pressure goes up, you have blood pressure problems, depression, just so many other symptoms that come from having chronic pain. So getting rid of the pain, slowing the pain down, praying, meditating, concentrating, finding a hobby, not giving up, all these things help me. I like to the outdoors, and you know, this outdoor channel that you're watching, you say, well, what's this got to do with the outdoors? Well, it's got a lot to do with it. It helps me emotionally. It helps my mind to release good thoughts and things. And when you can't do what you love because of pain or injury or something like that, all these other symptoms come along with it. I began to relieve stress. I would eat too much. Why that helped, I don't know. So the weight come on, and lack of exercise, the weight come on, and it just it's like a snowball going downhill, getting bigger and bigger and bigger with a health issue. So I started walking a little bit here and there, trying to flex. You've got to keep your muscles from drawing up and having spasms and knots in them, and sometimes you're able to do that, sometimes you're not, you know. But you know, we can't just run to a massage parlor unless you've got a lot of money and your insurance pays for it. So you've got to figure out a way to help yourself, and you know, walking and light exercise, flexing yourself, and even trying to work through the pain. But find yourself a hobby. Hunting, fishing doesn't take a lot of, it doesn't require a lot of physical activity. I've got an old truck that I piddle with and work on from time to time. Little things I can do, sitting in a chair. You know, I can't get down and crawl around on the floor, but I can sit in a chair and just piddle. Do it, light things to it, and when you get tired and you see that you're suffering a little more, then you can quit, you know, and come back to it later. But if you get in a shape to where you sit down and you quit and you give up, then the heart, blood pressure problems in your heart, it starts getting weak. Your circulation, all these other symptoms derive from this problem that you have in your back, this physical pain. And meditation and prayer and thought and keeping your mind clear and try to escape the pain. Sometimes you can't do it. I'm not preaching to the choir right now. I understand that there's times that you just can't even get out of bed. I've been there and still have those moments in my life where I can't do anything at all. But when you can, and you get a little bit better and you're up and down, try to not overdo it, but do something. Keep yourself moving, and keep your mind and your thoughts. So I want to try to encourage you to, even though you have these severe back problems or these kind of any other kind of health problems that disables you to the point to where you can't live your life, I'd like to encourage you to pray. You know, get in that place where you can spiritualize and not rationalize the situation. You know, God is able to help you with your problems, but sometimes He allows us to go through these problems, these health problems, and we don't understand it. But we can't give up. We have to keep going. If we don't keep going and keep moving and being active and things, all these other health problems will come up and arise in your life, and you'll go downhill real fast. And so I encourage you to find a hobby, something that you like that may not be real physically demanding, to pray, like I said, get close spiritually, and try not to over-medicate yourself if you're on medication. That just causes other problems. I know with many people that I've talked to, give them stomach problems and bowel problems, and it's a hard situation, and I know and I understand it. And that's like I said, I'm no professional. I'm just giving you my experiences, that what helps me the best is to try to stay active and keep going. Building your lungs up when you walk helps pump that oxygen through your body, and your blood flow, and all these things. They're all an intricate part of your life that has to, it's necessary. And I know a lot of people who have ended up to be bedridden when it started out, a slip or ruptured disc, and all these other health issues arise from that, and lack of activity. And I'm not saying when you're in a full-blown episode to run out and walk and exercise and do these things, but when you feel a little bit better and you're able to get up and go, try to stay on top of things. I've seen it time and time again where people just give up, and we just can't give up if we're going to be any use at all to our families, and we owe it to ourselves to try to take care of ourselves the best we can. A lot of people say, well, Jeff, I've seen you go down for years and years and years, but I'm actually in a shape right now and to a place to where I don't dread waking up in the morning like I used to. And I still have sleep issues. Even with the weight, you can develop sleep apnea when you gain a lot of weight. Just a whole host of things that can happen and derive from a slipped disc or spinal stenosis, bone spurs, arthritis, all these things in your spine. And you got to remember, all those nerves from the base of your head all the way down to your tailbone. There's nerves that feed different parts of your body. And inflammation, try to keep the inflammation down. Stay away from foods that cause inflammation. All these things like drinking sodas, we call them pops around here, soft drinks, with all the sugar. Being inactive can cause diabetes. There's just so many things. So I try to get up every morning and thank the Lord for another day of life. And I tell Him that I love Him and I'm grateful. And that helps. That helps start the day on a positive note. And then I try to walk just for a few minutes, depending on how I feel that morning. And sometimes we're able to walk quite a bit, And then I rest. There's periods of time where I rest. And you know yourself, you know your body, you know what you can and can't do. I like to say that when I overdo it, I know what's coming. Even heartburn, acid reflux, and GERD, with obesity, those problems come. And overeating, you get some of you may have a hiatal hernia, and acid reflux and GERD, raise your bed up, the whole 9 yards of things that can help that. But when you have all these complications and these health issues all wrapped up together. You got to try to manage them so that you're not overwhelmed with sickness. And so I try to have little hobbies, and that's one reason that me and my son wanted to start this YouTube channel. Maybe it keep our mind active and keep us busy and try to overcome the health issues. It doesn't matter how old or young you are, who you are. Your health is one of the most important things. Your spiritual life and your health and your family and the love of people are the most important things that we can do in life. And that's my advice. You can take that or leave it, but that's my opinion. And I hope that something I may have said or done will bless you and encourage you to get out and look up into the sky and realize that there's a creator. Realize that we live in a world that's cursed, and there's a lot of problems. Things are going on in the country today that we don't understand. And but you've got to take care of self best you can. And first and foremost, if you can't love yourself, you can't love anyone else. And we want to be that complete person that we can be as possible as we can be, even with these health issues. You can make a difference. You can make a difference in other people's lives. If you're an elderly person and you feel like you're useless and you can't help anybody, you can pray for them. You can smile. You can share your words of wisdom with them and the knowledge that you've gained throughout your life. And there's nothing like sitting down talking to somebody who's mature and has a life's experience. And I consider myself the elderly now. I'm up there in years. We don't want to admit it that we're getting older, but to this younger generation, the millennials, they're looking to and fro, and we can't lose our history. We can't lose the wisdom of the older people, things that were passed down through generations. And the doctor that I saw, a very wise man, really helped me in my life by giving me these suggestions and telling me how I can help myself and take it to heart. It's not a one fits all situation, because everybody's different. But if we can get in the mind state that we're still of value and we can still contribute to society and we can still love people and help people, there's things that we can do. Like I said, on the spiritual side, through prayer. Prayer means a lot. It really does. And when you pray to a higher power, to God, and He hears you, He can change things in your lives. And I'm glad that I was able to make this video. I hope it'll bless someone out there on our YouTube channel that's subscribed to us. You guys hang in there, and we'll get you on the next video.